Good morning, guys. Okay, we're going to be starting on chapter 15 on page 539. Again, as always, it is your responsibility to read the entire chapter. I'm going to hit on the big points that are going to help you with studying and helping with the homework. And then as we start using the live lecture, we can always kind of go over some of the stuff more in depth as a class if we want. So the first thing off is the introduction to the clinical laboratory on page 539. You need to highlight where it says the clinical laboratory test results are often used along with a thorough health history and physical examination to obtain essential data needed by the provider for accurate diagnosis and management of the patient's condition. That needs to be highlighted. You also need to highlight where it says when the body is healthy, its system functions normally, and a state of equilibrium of the internal environment is said to exist. This is termed homeostasis. When the body is in the state of homeostasis, the physical and chemical characteristics of body substances, for example, fluids, secretions, and excretions, are within an acceptable range known as the reference range. That needs to be highlighted. If we go on over to page 540 under laboratory test, please highlight where it says a laboratory test is defined as the clinical analysis and the study of materials, fluids, or tissues obtained from the patients to assess in the diagnosis and treatments of the disease. For the purpose of laboratory testing on page 540, please highlight number 1 and 2. And if you look on page 541, table 15.1, please highlight that hematology and highlight where it says it's the study of blood and blood-forming tissues. You also need to highlight where it says the category immunology and blood banking. The definition, which is laboratory analysis in immunology and blood banking, deals with the studying antigen and antibody reactions to assess the presence of a substance or to determine the presence of a disease. That needs to be highlighted. On page 542, for the cytology, highlight that the cytology deals with detection of the presence of abnormal cells. You also need to highlight on 452 where it says to assist in the differential diagnosis of the patient's condition, 2 or more diseases may have similar signs and symptoms. The provider orders laboratory tests to assist in the differential diagnosis of the patient. That needs to be highlighted. Also highlight that a diagnosis of the streptococcal sore throat must be made with a laboratory test to differentiate it from other pathologic conditions with similar signs and symptoms such as pharyngitis. So the doctor may order, a certain lab test, but he may give 2 diagnoses because he's wanting to rule out one of each with certain testing. You also need to highlight where it says to obtain information regarding a patient's condition when not enough concrete evidence exists to support a clinical diagnosis. On number 2, also highlight where it says to evaluate the patient's progress and to regulate treatment. Also in the last part on page 543 on number 2, also highlight that a patient with diabetes who measures his or her blood glucose level each day to regulate insulin dosage provides another example of laboratory test used to regulate treatment. Number 3, establish a baseline level. Number 4, to prevent or reduce the severity of disease. Also on number 4, you need to highlight that as routine tests are performed on a routine basis on apparently healthy patients, usually as part of a general physical examination to assist in early detection of a disease. Types of clinical laboratories highlight that a medical office may use an outside laboratory for testing, or the office may contain its own laboratory known as a physician's office laboratory, a POL. The physician's office laboratory, a Clinical Laboratory Improvement Amendments of 1988, also known as CLIA. That needs to be highlighted. You also need to highlight that CLIA waived and commonly required, such as glucose determination and urinalysis, are performed in the POL. A waived test is a laboratory test that has been determined by CLIA to be a simple procedure that is easy to perform and has a low risk of erroneous test results. That needs to be highlighted. If we go on over to page 544 under refrigerator, highlight that the temperature of the refrigerator must be maintained at 36 degrees Fahrenheit, 2 degrees Celsius to 46 degrees Fahrenheit and 8 degrees Celsius. You also need to highlight where it says the temperature of the refrigerator should be checked at least once each day and documented on a refrigerator temperature log. So this is going to go, once you're in your medical office, there's going to be OSHA and there's going to be CLIA. CLIA is where you have to record everything. You'll have charts around your refrigerator that you'll log every day on what the temperature reads. And you do have to keep these records. If we go on over to page 545 under procedure for inspecting and activating an eye wash station, you need to highlight the procedure for performing a weekly eye wash check is outlined here. Become familiar with 1 through 14. For the room temperature and lighting, you need to highlight down where it says the temperature range required for the storage of testing materials and for performing tests is stated in the instructions accompanying them. It is usually a room temperature that falls between 59 degrees Fahrenheit, 15 degrees Celsius, and 86 degrees Fahrenheit, 30 degrees Celsius. Excuse me. You need to become familiar with the laboratory directory. Please highlight where it says name and current procedural terminology code of the test, also known as your CPT code. You will hear that a lot. Highlight reference range, the amount and type of specimen required, supplies necessary for collection of the specimen, techniques to be used for collection of the specimen, special instructions, patient preparation, proper handling and storage of the specimen, instructions for transporting the specimen, causes for rejection of the specimen by the laboratory, use and limitations of the test, methodology used to perform the test. On table 5.2 on 546 and 547, these are some of the common lab tests that may be drawn. So it is really good to kind of go over that. If we go on over to page 548 under parts of a laboratory request form, please become familiar with 1, 2, 3, 4, 5, and 6, figure 15.6. And then if we go on over to page 550 under table 15.3, for these are going to be laboratory profiles. So if someone says that they're going to order a CMP, that's a comprehensive metabolic panel. Inside that test or the following: an albumin, ALP, ALT, AST, bilirubin, BUN, calcium, carbon dioxide, chloride, creatinine, glucose, inorganic phosphorus, potassium, protein, sodium, and triglycerides. So some of the common tests that are performed are we're going to order a CMP, a CBC, and a lipid panel. This kind of helps you look at what is inside each of those testing and what it includes. If we go on over to page 551, you need to highlight number 7, number 8, number 9, and number 10. If we continue on 552 under laboratory reports, highlight that laboratory report forms are used to relay the results of the laboratory test to the provider. You do need to come familiar with what is included, what the included information on the report is. Number 1 through 9, those need to be highlighted. And under number 9, please highlight that a patient accession number or laboratory number is assigned to each specimen received by the laboratory. Its purpose is to provide positive identification of each specimen within the laboratory and to allow easy access to the patient's laboratory records should a test result need to be located again. You also need to become familiar with a reference range and the acceptable perimeter within which the laboratory test results of a healthy individual are expected to fall. If we go down to the next paragraph, you need to highlight that laboratory reports are delivered to the medical office by one or more of the following methods: faxed, mailed, hand-delivered by a laboratory carrier, or sent electronically from the laboratory computer to the medical office computer. On figure 15.7, that is what a common laboratory report form may look like. And if we go down to the laboratory documents and the electronic medical record, you need to highlight that this provides distinct advantages for the medical office using an electronic medical record and EMR. Laboratory requisition forms can be completed on a request form displayed on the computer screen using radio buttons, drop-down menus, and free text entry. Depending on the medical office policy, the form can then be transmitted electronically to the medical laboratory or printed out and placed with a specimen for transport to the laboratory. You need to go down 2 more paragraphs and highlight that in addition, results of the laboratory test performed on a routine basis, for example, glucose testing and cholesterol testing, can be assessed by the computer and plotted on a flow sheet. And then if you look on page 554, figure 15.8, that's a computer-generated laboratory report. On page 555, patient preparation and instructions, factors such as food consumption, medication, activity, and time of day affect the laboratory results of certain tests. That needs to be highlighted. You also need to highlight that a specimen obtained from a patient who has not prepared properly may invalidate the test results and necessitate calling the patient back to collect the specimen again. So let's go on over to page 557 under the fasting. Highlight where it says any individual test, including, for example, fasting blood glucose, FBG, or OGTT, or profile including these tests, a comprehensive metabolic profile, a lipid profile, requires the patient to fast before the specimen is collected. Fasting involves abstaining from food and liquids except water for a specified amount of time before the collection of the specimen, usually 12 to 14 hours. If we go on over to the medication restrictions, highlight that an antibiotic therapy administered before collection of a throat specimen for strep testing may cause a falsely negative test results. So this goes back into stating that we need to make sure that we're asking the correct questions for the patients. What medications are you taking? Have you eaten? When's the last time you've had anything to eat or drink? Before you draw your lab test or you do testing like your strep test, because certain medications can cause incorrect answers for your labs. And we may not be able to diagnose the patient correctly. Okay, on 557 under collecting, handling, and transporting specimens, you need to highlight where it says a specimen is a small sample or part taken from the body to represent the nature of the whole. On 558, you need to highlight where it says the in vivo characteristics of the specimen may be adversely affected. Guidelines for specimen collection, highlight number 1, 2, 3, and 4, 5, 6, 7, 8, and 9. And basically, you just need to highlight the numbers, but you do need to read over each of these. Please become familiar with figure 15.11, figure 15.12, 13, and 14, 15 and 16, with table 15.4, procedure 15.1. If we go on over to page 564, I need you to highlight under the purpose of clinical laboratory improvement amendments, highlight where it says which establish standards for improving the quality of laboratory testing in the United States. Please highlight under the categories of laboratory testing, highlight number 1 and number 2, number 3. For the requirements for moderate complexity and high complexity testing, highlight number 1, For number 2, highlight the second and third bullet point, and then highlight number 4. If we go on over to page 566 under the CLIA waived laboratory testing, highlight that it says most POLs perform only tests that are CLIA waived. You also need to go down and highlight that an analyte is a substance that is being identified or measured in a laboratory test, such as a glucose, hemoglobin, or a group A streptococcal test. If you go down to where it says the CLIA waived tests that are performed most frequently in the medical office include, please highlight that, as well as continue highlighting the urinalysis and fecal testing, hematology, blood glucose, and immunology. If we go on over to page 567, I need you to highlight the quality control in table 15.5. And then if we go down under that table, highlight where it says accurate and reliable test results. Of particular importance are the quality control procedures, which must be carefully followed when working with a testing kit. If we go on over to page 568 and 569, please become familiar with figure 15.18, 19, and 20. On 569, please highlight for quality control, QC, may be defined as the application of methods and means to ensure that the test results are reliable and valid, and errors that may interfere with obtaining accurate test results are detected and eliminated. You need to highlight for the number 1, the storage of handling of test. Highlight A and B. For number 2, the stability of testing components. Highlight number C. And for 3, under the calibration, highlight that calibration is a mechanism used to check the precision and accuracy of a test system, such as an automated analyzer, to determine if the system is providing accurate results. If we go on over to page 570, become familiar with 15.22 and 15.23 figures. And then on number 4 for the controls, please highlight that internal controls is built into some systems. That needs to be highlighted. You need to also highlight on the other side on page 570 that a low-level control, also known as a level 1 control, produces results that fall below the reference range for the test. A high-level control, also known as a level 2 control, produces results that fall above the reference range for the test. If you go down a little bit further, you also need to highlight where it says the failure of a control to produce expected results may be caused by a deterioration of testing components after improper storage or use of components past their expiration date, improper environmental testing conditions, or errors in technique used to perform the procedure. Please highlight number C. And if we go on over to page 572, become familiar with figure 15.25, and as well as the qualitative and quantitative test results. Both of those need to be highlighted. And that concludes on chapter 15. Again, it's your responsibility to read the entire chapter, become familiar with all of the tables and the figures in this chapter, just because these are going to be things that we're going to be doing in the lab. So if you go ahead and get a head start on studying them now, then you'll be a little bit more at ease when we actually get to do them. The terminology review, again, I do want you guys to make sure that you're reading over that as well. If you have not been in the chapters, I want you to go back and make yourself a study guide or flashcards based on the terminology review. It would be great for the studying.